Hey, welcome. You're here because you want to hear about how quickly does endometriosis grow back after pregnancy, and we're going to talk about it. I am Dr. Perkins, a board-certified OBGYN, and I'm excited to dive into this topic today. By the end of this video, you will have a better understanding about what exactly is endometriosis. You'll know, is pregnancy a cure for endometriosis? We'll talk about the factors that could impact the regrowth of endometriosis after your pregnancy. And then we'll kind of dive into what does the landscape look like postpartum when it comes to endometriosis. All right, so I'm glad that you're here, and I'm glad that we're having this conversation because endometriosis, even though we say that it impacts 1 in 10 females, honestly, I feel like there are more people with endometriosis out there than know that they're aware. I think it's probably more like 2 to 3 out of every 10, but the data says 1 in 10. So either way, we know that there are tons and tons and tons of women being affected by this disease, and there is just not enough out there to really help you. And so while medicine works on improving our knowledge and options of treatment, during this time, we have this situation and we're going to deal with it the best way we can. And so you're pregnant or you're postpartum and you're now wondering how quickly does endometriosis return? Let's kind of backtrack a little bit and just talk about what is actually happening with endometriosis. So endometriosis is a condition where tissue that is similar to the inside part of your uterus. This is the part of the uterus that causes bleeding, that causes cramping, that has a lot of inflammatory changes happening each cycle when you have your menstrual cycle. And this tissue can be found elsewhere in your body. So think about this. You're having a menstrual cycle. Your uterus is working so hard with clearing this tissue that has been built up waiting for pregnancy. Pregnancy doesn't occur and then it needs to bleed and shed. As your uterus is doing all this work and is hormonally responding to your ovaries, sending all the right messages, all the beautiful things that happen during a normal menstrual cycle, when you have the same similar tissue elsewhere in your body, I imagine it as being that you're having mini menstrual cycles elsewhere in your body because your tissue, this tissue, regardless of where it is, inside of your uterus, on your abdominal wall, on your ovary, on your bowel, it is responding to the same hormones that say bleed, the same hormones that say it's time for a menstrual cycle. And so you have all these little collections and implants and blood and inflammation, all this activity happening more globally inside of your system instead of just inside of your uterus. And so it is distressing, okay? So if you have this, I'm gonna say I understand medically, but I really truly don't understand what you're going through. And I wish you all the best in your journey. And so we're here to learn. Let's talk about how endometriosis may return or how it changes during pregnancy. Now, in general, there's no cure for endometriosis, okay? So maybe one day, we're not there yet. No cure. So when these implants are elsewhere in your body, unless we are physically going in, removing them, burning them, destroying them, even during pregnancy, those implants are still there. They're still active, they're still present. Now, what changes when we think about the landscape of pregnancy is that when your pregnancy develops, your body produces a lot of progesterone. Progesterone is the hormone that quiets the inside part of your uterus and that tissue. Now let's think about it. When you're not pregnant, estrogens are really dominant. Estrogens cause this tissue inside of your uterus to grow and to become more fluffy and to be more vascular and to do all the things thicker. Think thickness. When progesterone is released after you ovulate, progesterone quiets that space and it says, let's now prepare for shedding. Let's do the opposite. Let's relax. And so progesterone is protective and it works in your favor. When you're pregnant and pregnancy occurs in your fallopian tube and the pregnancy moves to your uterus and establishes itself, something is formed on your ovary called a corpus luteum cyst. It is a cyst, and for every growing pregnancy, a cyst develops. The purpose of that cyst is to help to produce a lot of progesterone. A lot of progesterone, a lot of progesterone. As your placenta develops, it continues to produce a lot of progesterone. Now, in general, progesterone quiets the activity of endometriosis. It is a beautiful thing. This will bring you relief. It won't let the endometriosis implants go away. It won't necessarily cause them to shrink in any way, but it will quiet the activity, the inflammation, the changes that happens in your immune system, all of this that is impacted by endometriosis. It quiets it all down. And so pregnancy often will bring relief when it comes to endometriosis types of pains. Now, you continue throughout pregnancy and deliver your baby, and your cycles come back. In addition to your cycles returning will be the same activity that now returns with endometriosis implants. The quietness of those implants will go away because hormonally they respond just the same as your uterus would. So if your uterus is bleeding and now active again with a cycle, those implants, wherever they are internally, they're also active again. And sometimes patients will say that it comes back with a bang. It's like, oh my gosh, like this pain is insane. This pain is back again, and it may even seem worse than what it was before. If you're not breastfeeding, this can happen as early as 6 to 8 weeks postpartum. If you are breastfeeding, especially exclusively, this may be delayed by months, all the way up to even 12 months after you deliver your baby. As far as how bad your pain is, may really be linked with the severity of your endometriosis before pregnancy. It may also be dependent on whether or not you've had surgical excisions before. There's sometimes when your pain is just so bad with endometriosis that you've had 1, 2, 3, or even 4 surgeries for the same exact pain and problems. And what we see is that the more surgeries you've had, the more intervention you've needed, the greater the severity of the pain once you are now postpartum. Now, to be clear on our question today, we're talking about how fast does endometriosis regrow or return in your system. And so it doesn't go away, it just gets quieted. And as far as when the pain and the symptoms return will be all dependent on how quickly your cycles return postpartum. Additionally, when we think of the causes of endometriosis, like why does this even happen? We don't really have all the answers yet. But what I can tell you is that we know that retrograde menstruation is kind of key. So I'll bring the plush back here. So when we have our cycles, we expect that the contractions of the uterus will push the menstrual tissue out through the cervix, out through your vagina to the external world. With retrograde menstruation, what we're thinking theoretically is that some of this tissue that should be going down and outwards, it is actually being pushed towards your fallopian tubes and through your fallopian tubes, past your ovaries, and then it's getting sprinkled inside of your abdomen. Because on the other end of your fallopian tubes, this area is actually open to your internal system. And so we're thinking your cycles are going through your fallopian tubes and entering inside of your abdomen. So when you are now having your first period postpartum, it is possible that for every cycle beyond that, you could still be pushing more tissue that's inside of your uterus that should be going out. You can be pushing that through your fallopian tubes. And each cycle could be adding to the amount of tissue that is being found inside of your abdomen. And honestly, like when I do endometriosis type surgeries and you look inside, it almost looks like you're taking paint on a brush and throwing it on the walls of your internal organs on the inside. And depending on how deeply they infiltrate will really impact the amount of pain that you're having. So does pregnancy itself cause more endometriosis implants inside your body? No. With each cycle, regardless of whether or not they're happening before pregnancy or after pregnancy, you are at risk of adding to the overall amount of tissue that is being found inside of your abdomen. And that is no different postpartum. The biggest difference here is the hormonal changes that happens during pregnancy, that quiets things, that makes life so much better. And postpartum, they re-emerge, and sometimes they're greater than what it was before. I hope this information has been helpful. I hope you've learned something today. And as you go through the postpartum phase, I say speak with your doctors, come up with a plan, and be prepared. And if you are now undergoing this more intense pain, talk to your doctors about what can be done and how you can get relief. Thank you so much for listening. And today, again, I'm Dr. Perkins, a board-certified OBGYN, and I'm so glad you're here. And you know what? Because you're still listening, I actually think that there's another video that might be so helpful as we have these discussions, and that is listed below in our video today. Go ahead and look below, click on the link, and we'll redirect you there. There's so much more to learn. There's so much more that we can do about our bodies, and I'm here to try to help you on that journey. Thank you so much for being with us. Have a great one.